there was a proposal that the Adams administration put forth in New York to require retired public sector workers, and there's 250,000 of them roughly in the city, to switch over to a Medicare Advantage plan, which is a privately run Medicare plan, will be managed by Aetna, as opposed to the public Medicare that they were able to get, or get their own private health insurance, right? There was a lawsuit on this. Many of the retirees pushed back against it. And just recently, a judge ordered, this came down on Friday, a judge ordered a permanent ban on the plan, essentially stopped the plan in its tracks, saying that the city promised these workers access to Medicare, traditional Medicare, and could not force them to switch over to privatized Medicare.
I agree. I don't think they should be forced to switch over. I understand there's some budget concerns or whatever it is, but if these people worked their careers and their lives, and this was what was promised to them, you can't switch it up, especially in a position where they're not able to be as nimble career-wise or financial-wise to some sort of different financial situation. Like, you can't do that. It's just...
Well, yeah, certainly a complicated issue here. I think we could start with the fact that the mayor is saying that this would have saved the city $600 million a year. And so we do see that we're in the budget crunch that we're in. We just talked about the overburdening of our resources with the migrants. And so $600 million a year would go a long way, right?
Yeah, absolutely. But again, I agree, if there was a promise made, basically, even if it wasn't like explicitly said, if this was what people were told was going to happen, then I don't think it's fair to do that. That should be off the table.
I think there is a concern about privatizing Medicare or any of these government programs that we've come to rely upon. I remember President Bush wanted to privatize Social Security, right? Wasn't that one of his proposals? And
yeah,
received a lot of pushback with good cause over that.
Yeah,
I think it is something that we need to be very mindful of. You always hear about these efforts to privatize these resources. I mean, even NYCHA, they were talking about that, privatizing the housing authority. I mean, there are certain things I think that the government does that obviously they're not perfect, but instead of trying to take it off the government and make it completely private, run by a private company, I think our focus should be on strengthening the programs.
I agree. And there's been a lot of effort to privatize certain things, generally coming from the GOP, where, like I said, Bush tried to do Social Security. GOP has tried constantly to try to privatize the U.S. Postal Service, which it's just, these things should not be put into private hands, because then it's going to turn into a for-profit endeavor. People are going to eventually lose out on it. And we've seen this issue with prisons being privatized, which I totally disagree with. And we're seeing the situations there. First of all, conditions aren't as great as they could be, but also you've got things that are encouraging 100% occupancy, which is ridiculously unethical in my opinion. These things shouldn't be put into privatized hands.
So in the judge's July 6th ruling, which was when a preliminary injunction was issued prior to the permanent one that we just saw, the judge stated that the retirees have shown that numerous promises were made by the city to then New York City employees and future retirees that they would receive a Medicare supplemental plan when they retired, and that their first level of coverage once they retired would be Medicare. It's always interesting, right, when they say, well, this is Medicare, it's Medicare Advantage. But as we know, that's private Medicare. That's not the same thing.
Right.
And then there are debates about the level of care that you receive and whether your healthcare costs would increase, right? And retirees in this lawsuit were raising concerns that, in fact, their cost of healthcare would go up under this plan.
Right. And it's a concern of everybody, but it would be even more of a concern for someone on a fixed income and that doesn't have, one, fixed income, and two, doesn't have the ability to re-enter the workforce at a capacity that might bring them the extra income that they might need. right? It's not a good thing to do. Someone in chat said, was that only affecting DC 37?
DC 37 is now pushing to have all of their members call the council members to support a bill for this plan. So DC 37 is in favor of the plan, but this would affect, what would have affected every retired public sector worker in the city. So you have teachers under this, you have all kinds of people.
Right. It looked like it said there was 250,000 retired employees, and their elderly or disabled dependents.
Right.
Yeah. Yeah, it's just I don't think it's a good plan. I understand the need to shore up the budget, or I mean that's a huge amount of money to free up.
Mm-hmm.
But I would think that they should look elsewhere. There's got to be tons of places where they can streamline processes that's going to save money and whatnot.
Well, here's a quote from the mayor's spokesperson, Jonah Allen. This Medicare Advantage plan, which was negotiated closely with and supported by the Municipal Labor Committee, would improve upon retirees' current plans, including offering a lower deductible, a cap on out-of-pocket expenses, and new benefits like transportation, fitness programs, and wellness incentives. This decision only creates confusion and uncertainty among our retirees, he said. So, of course, to see the debate here is centered around, is it a better plan or is it not? And that might also depend on who you are, right? It might be a person-to-person thing.
But is that a better plan? Is that a better plan for everyone, or is that a better?
That's what I'm saying. That is the question, right? Is it
for some people?
For certain people.
Is it a better plan in the introductory phase, and then next year, since it's a private company, they decide they're going to change it? Like, there's a lot of things I think to consider there.
Right, and I think you are right to be suspicious anytime you're dealing with privatizing something like this. Privatizing Medicare, I think, should raise eyebrows.
Yeah, absolutely. Janet's asking, does this even include MTA employees?
MTA employees are not considered municipal workers, are they?
That I don't know. I do not know there. These are 250,000 retired public sector workers. Would they be considered public sector workers?
Well, public sector, but are they municipal workers?
Right.
Are they directly working for the city? If they're MTA employee, they wouldn't be, right?
I wouldn't think so. Yeah, I wouldn't be able to answer that specifically. That would require more looking into, but yeah, I wouldn't know. I think the judge did good in this case. If going forward, Adams wants to try to push this going forward on a different generation or a different group, then I think that may be something to be discussed. But for people who are retired, who have worked for a certain outcome, I don't think it's good to switch this up in their retired life.